Hello and welcome to this special EULAR preview podcast brought to you by the Lupus Forum. My name's Ed Vital. I'm from the University of Leeds and I'm the chair of the steering committee of the Lupus Forum. And today I'm joined by one of our other steering committee members, Professor Chris Edwards, who's a consultant rheumatologist at University Hospital Southampton NHS Foundation Trust, an honorary chair of clinical rheumatology in the University of Southampton. Welcome, Chris.
Hi, Ed.
Good to see you. So I'm sure you're looking forward to EULAR as much as I am.
Yep.
So in this podcast, we're going to discuss what we've seen on the programme that we're most looking forward to, give you some pointers to sessions you might want to consider. There's a lot of lupus content, and the most important of that is captured in our highlights brochure, which you can find on the Lupus Forum website. We've identified more than 70 abstracts across the conference, which cover a wide range of key topics and therapeutics, as well as non-therapeutic subjects. As always, if you want to be informed about the key abstracts for rheumatoid arthritis, psoriatic arthritis, and axial spondyloarthritis, there's a similar highlights brochure and preview podcast for those diseases over on the Immune-Mediated Inflammatory Disease Forum. So, Chris, do you want to go first and just give us a picture of what to look forward to this year?
Yeah, it's this time of year where you start trying to plan, don't you? Thinking about your presentations and then thinking about how do I get to go to all the things that I'm interested in.
Yeah.
So I was having a look at the program and look at the sort of layout of it and seeing where the lupus content would be. There's a session that I'll come back to in the moment, which is a good kick-off on the Wednesday. Come back to that in a moment. There are a whole number of posters. The posters and those presentations are divided up into 4 groups. There's 2 that are clinical on Thursday and Wednesday, and 2 that are more basic that are on Friday and Saturday. So there's content across the whole of the meeting. And then I've sort of picked from those things that might be interesting. And there are newer therapies, there are bits around other therapies, and well, we can discuss other things as well as we go through. So the first thing, good start for people to look at was Wednesday the 12th. There's a session in Lupus, What's on the Horizon? And I think that's probably a really good start to the meeting. There's a few great speakers in that session. David Eisenberg's chairing, Laurent Arnaud and Raquel Ferreira are giving the presentations. And I think that's going to set the scene around what's happening with new therapies, and probably will touch on some of the things that we're talking about because they've become so interesting, I think, over the last couple of years. And then particular presentations that I'd looked at. CAR T therapy is definitely there. And this is something we're all discussing and trying to work out how do we do it? Should we take part in the trials? What's the risk? What sort of patient should be looked at? And there are 2. So Friday, the 14th, middle of the day, that session has CAR T and B cell immunology. So that's around what it does to B cells. And Laura Bucci is doing that presentation. And then on the Wednesday the 12th, George Shett is giving us some more information about the treatment with CAR T of inflammatory rheumatic disease in general. So, hopefully he's going to give a bit more detail of some of the stuff that's been published already in the New England Journal paper. So that was one area. Then other newer drugs, deucravacitinib is in trials in lots of different disease areas, isn't it? In psoriatic arthritis, in Sjögren's syndrome, and certainly in lupus. And Eric Morand is doing a presentation on Wednesday around deucravacitinib, which of course is a TYK2 inhibitor from the phase 2 Paisley trial. And there are various bits around deucravacitinib in various sessions, not just within the lupus sessions. The other one I'd looked at was there's an oral presentation by Anka Akanas, which is on Wednesday as well, and that's voclosporin in lupus nephritis in that area. And I suppose for me, I can use voclosporin in my practice, but I'm trying to work out where and with who. So that's one I want to go to, because then I can see if I can glean anything from the presentation around when to use it and how it might be used to use less steroids as well. I think that's the suggestion from the presentation that's been giving. And then there's a smattering of bits and little cuts of data from obinutuzumab, from anifrolumab, from belimumab. There's a whole load of other therapies. So that was sort of my starting areas of interest.
Yeah, that's great. I noticed those as well. And I'm also following the CAR T debate with great interest. I have some of my own questions about exactly how that works and what's been shown. So there'll probably be a lively discussion in some of those sessions, I think.
Yeah.
So yeah, I also noticed I looked out for some of the non-commercial stuff. So it's great to see new therapies coming, but there's also some really good work from the academic centers. And one thing that I noticed was there were quite a few abstracts about rituximab. So it's a subject that's always been quite close to my heart, and for many of us, it's a really important drug for managing lupus still, despite the negative trials all those years ago. So there were a couple of things. There were two abstracts about rituximab from the British BioLag Biologics Registry, headed by Ian Bruce, addressing two pretty important subjects. One is neuropsychiatric lupus. So if you follow lupus trials, you see neuropsychiatric manifestations are usually excluded from lupus trials. So there's a bit of a lack of evidence-based biologic therapy. There's open label experience with rituximab, and that's why it's highlighted in the EULAR guidelines, but this is probably the biggest chunk of data on that. And there's another one also from that registry that looks at another topic that's important across the whole field of lupus therapy, which is that when people get a response on clinical measures like BILAG or SLEDAI, does that also translate into patients having an improvement in quality of life, which is not necessarily a given, because there's a lot in your quality of life with lupus that's not dictated by just inflammation. It's sort of longer term problems and therapies and so on. So I thought those were interesting. There were also a couple of case series, but big case series. One from Japan that's looking at rituximab in lupus nephritis, and one from India that looks at just a large series of rituximab treated patients, but with a focus on the patterns of infection that occur there. So I thought those would be something I'll be looking out for.
Yeah, and I think, and Ed, I think those are really interesting because exactly as you said, because the trials have been negative, accumulating the data and the sort of experience that many of us have with using rituximab from multiple different countries, Japanese data, Indian data, data from all around the world, is really helpful for clinicians to see how rituximab might work.
Yeah, that's right. And like originally we just had rituximab. That was the only B-cell depletion there was. But now if you look at the rest of the conference, you've also got obinutuzumab and ianalumab, which are like next generation monoclonal antibodies that deplete better and are looking very promising in trials. Then you've got CAR T, which is trying to deplete even more profoundly. There's a few other little things around in development. So the whole field of B-cell depletion, how it works, what are the risks, what are the benefits, who's it right for, is becoming more important. And what you learn about rituximab probably has a lot of important implications for what you know about these other drugs.
Yeah. And then it's interesting what you said around that spectrum of, so you can turn off B cells a bit, you can turn them off a lot, you can turn them off an enormous amount on all of those therapies. And so understanding that difference and then selecting the patients that may be best for those little bit, medium bit, or a lot of turning off B cells would be really interesting.
Exactly, and even if is that the only thing that matters for getting a response? So, is depth of depletion the only thing that matters? Which is kind of the thesis of CAR T therapy, isn't it? Just that as long as you go deep enough, you'll always get a response and you'll cure the lupus. Now, I have some doubts, but coming as somebody who always pushed for deeper depletion, I have some doubts as to whether that's all there is to it. Actually, a lot of lupus is innate.
Okay.
So I'll definitely be looking at those. And then there was one other quite big not about therapeutics per se study, was another one on the LLDAS, which I think is still an important part of managing lupus. So LLDAS is in a low disease activity state, which was defined as SLEDAI 4 or less, nothing from the major organs, nothing new, PGA not too high, and prednisolone 7.5 or less. And that's important both in terms of like the treat to target strategy in the clinic that we're told to follow, but also in terms of clinical trials, like measuring the time you spend in LLDAS can be an important endpoint rather than just response. We know that's meaningful to patients. So one of the things which it may sound small to some people, but it is quite an important discussion is 7.5 actually the right steroid dose? EULAR have actually said, no, it's 5. So the treat to target recommended in the EULAR guidelines is 5, not 7.5. And there are some studies I've seen, I think we've discussed them on the Lupus Forum previously, that suggested there were clinically meaningful differences between 7.5 and 5. So the actual original LLDAS group, mostly Asia Pacific, led by Eric Morand, have done a big analysis addressing that question. So I'm going to look quite closely at that one too.
There's also, isn't there a session where some of the experts are going to be tested with really difficult cases? Isn't that an innovation, which I want to come
yes, well,
to see if people
yes.
might
Thank
be
you for
embarrassed.
reminding me about that. So this is at the end of the conference on Saturday, and it's a kind of new format for EULAR, which is that a difficult case will be presented, and then a panel of experts, including me, are going to give our opinions on the case and the correct management for that patient, any evidence that applies, difficulties, things to look out for to be done differently. But here's the twist. None of us have seen it before.
Yeah, that's why I'm coming. That's why I'm coming to the session.
Yeah, exactly. So if you want to see me squirm on the stage when they ask me some difficult question, I have to try and answer it. That's on Saturday.
Yeah.
And there's a few of them in other disease areas as well. So I think that'll be quite good fun at this year.
Yeah, I think that would be good. Yep.
Okay, well, that's all we have time for today, folks. I think that gives you a flavour of what's coming up in the conference, and I hope you've enjoyed the preview. Lupus Forum has plenty more EULAR content planned as the conference gets underway. There's a condensed overview of the most important abstracts presented every day. You can look out for that. That's our daily highlights. There's the highlights brochure on the website, as I mentioned. And as always, after the meeting, we're going to broadcast a Congress Review podcast where we'll be joined again by Chris, and we'll talk about actually what we saw in these abstracts, anything else that caught our eye, interesting things that went on in the discussions and questions. So that's a great opportunity to review what was presented and for you to catch up on what you might have missed. So don't forget to visit the Lupus Forum. That's lupus-forum.com, and download our EULAR 2024 highlights brochure, which includes details of my top abstracts. Enjoy the Congress.